Hello and welcome to Witchy Wellness Radio. I'm your host, Lauren Chalantani, women's holistic health coach and fellow recovering perfectionist. This podcast was created to show you that your body is not in the way, it is actually leading your way. I am very particular about the type of CBD and hemp products that I use. There's so much hype and lack of testing and quality in the industry. So the company that I love and use is Evo Hemp. Not only do they have a beautiful product like hemp seeds, CBD oil, gummies, even hemp chocolate, protein bars, protein powder, they also support a 40-acre co-op farm in Minnesota, which is farmer-owned, focusing on bringing equality and innovation back to Black, Indigenous, and other socially disadvantaged farmers. So if you are looking into trying any type of CBD or hemp products, head over to evohemp.com. The link is in the show notes, and make sure you use code WICHY, WICTHY, for 20% off of your purchase. Hello, everybody, and welcome back to another episode of Witchy Wellness Radio. Again, I am your host, Lauren, and this is a show you learn how your body and emotions are not in the way, but they're actually leading the way. And today we are talking with Dr. Dani Gordon. She is a double board certified integrative medicine physician and leading expert in integrative and cannabinoid medicine and resilience. She has treated thousands of patients with medical cannabis and is the vice chair of the UK Medical Cannabis Clinicians Society and is the author of the CBD Bible. She is the founder and medical director of Resilience.clinic and her UK medical practice and wellbeing platform with a focus on mental health, chronic fatigue, and chronic complex disease. She is regularly interviewed on TV, on the media, and has been featured in the Sunday Times, The Guardian, BBC, Vogue, and Marie Claire. I am very excited to dive into all things women's health and also CBD and THC, and kind of jumping into the more therapeutic use of psychedelics and altered states. We're gonna go everywhere in this episode. So welcome to the show today, Dr. Dani. I'm so happy to have you on. It's Thanksgiving in the U.S., so I'm so grateful to have you here.
Thank you, Lauren. I'm grateful to be here. It's so nice to celebrate virtually with you today.
I know. It was kind of a fluke in my calendar, but I was like, you know what? Let's do it. Because I love meeting new people, and this is an awesome topic that I want to dive into. And I know you're in the UK, so it worked out perfectly for both of us.
Yeah,
but
thank you.
Yeah. So I always start off the same way, asking, how did you get into this work? Obviously, you went through medical school, but what was kind of the thread line in your life that kind of led you to kind of being more into this integrative or alternative kind of, and also into the CBD and kind of THC world to integrate into women's health and beyond? Like what led you to be doing this work and writing the CBD Bible?
Oh, wow. Well, it all started a very long time ago, Lauren. No, but, of course, like you said, I went to medical school in the conventional way. And when I went into medical school, I was actually quite young. And I was very idealistic, and I still am in a lot of ways. But I went into medicine because I really wanted to empower people about their health and their well-being. And what I learned in medical school was actually quite a downstream disease management system, primarily focused on surgery and drugs. And in a way, of course, those things are very important in acute medicine when there's emergencies, acute medical problems. But I actually felt let down because I had gone through my own healing journey. Previously, I had like a kidney issue growing up, and I was on antibiotics all the time. And that really affected my immune system. And then I had all these problems with chronic sinusitis. And I managed to kind of heal a lot of my own issues, not using drugs, but using more natural approaches. So I thought I was going to learn at least something about that in medical school, but in fact, I didn't. And why I was still so passionate was, in medical school, when you're a junior doctor, you're seeing patients for the first time. I was seeing all these patients who were really suffering with many symptoms, chronic symptoms that were not well treated with the drug therapies that we had, or they had lots of side effects, or the drug therapy wasn't enough on its own. And I just felt that there wasn't um, a style of medicine that I saw that was helping these patients, and that's what I really wanted to do in my career. So I decided I would take another fellowship in integrative medicine, which I went on to do, in botanical medicine, and I did that in the U.S. and I went back to my practice in Canada and started using all these things. Um, and then a few years later, I had patients who were coming to me, and I was combining drug therapy with teaching them mindfulness and using botanicals whenever I could instead of sleeping pills and this sort of thing. And it's all going quite well. But I had a lot of patients using cannabis, and they would tell me about their use of cannabis. And I had some patients who had weaned themselves off of opioid painkillers, who had PTSD, and it really helped them recover from PTSD, who had really bad women's health problems like endometriosis, painful periods. And they all said, Dr. Dani, why aren't you using cannabis? You're an integrated medicine doctor. But I still had, all these preconceived notions that cannabis was bad. It was going to make everyone go psychotic. So actually, it wasn't until 2015 that I officially started prescribing cannabis alongside all my integrated medicine therapies. Although, before then I was still talking to my patients about cannabis. And once I did that, I added that to my practice because I became a chronic pain patient myself. I had a really bad accident. I got hit by a motorcycle when I was jogging overseas, and I had lots of problems with my hand. I blew apart a bunch of ligaments. I had some partially successful surgeries, but I had a lot of nerve pain. And I was told by two Harvard-trained surgeons on two different continents that I would need to take really strong painkillers for the rest of my life. And that didn't really sit too well with me. So of course I again went on my own integrated medicine journey and used a lot of my mind body practices, but I still needed something else for the pain. And I ended up using topical cannabis for my hand, for my nerve pain. And it was so effective. So that was the final push I needed, basically. And my patients were finally probably saying, "Oh gosh, it's about time." So I started, with a lot of trepidation prescribing cannabis because I was scared that someone was going to knock on my door and take away my medical license. I was scared what my colleagues would think. But what I found is that nothing bad happened. No complaints were made, and instead I had all these patients who weren't getting better with a lot of other things, and they were getting their life back because cannabis didn't cure them permanently, but it was such a quality of life medication. It was so effective for a lot of their symptoms, including women's health symptoms, that I just became an advocate for the use of this plant in a medical context.
Amazing, amazing. And it's like everything is leading the way, like nothing is in the way, like the tagline of the podcast. And
Yeah.
what I didn't know when I started researching, cannabis, whether it's CBD or THC, we actually have a system, like there's receptors in our body for this.
Yes. Oh, I'm so sorry.
You're fine, you're fine, you're fine. This is why we don't do it live.
Oh my. I don't even know where it's coming from. Where is it coming from?
Computer?
It's coming from my husband's computer. Okay, I'm going to blame him for that one. All right. Hopefully that should not happen again. Sorry about that.
That's so fine. That's so fine.
Oh yeah. Okay.
Yeah,
sorry.
that's
So, yes. So where were we? We were talking about the THC and the CBD, the endocannabinoid system.
Yep.
Yes.
Yep.
Yeah. So that is a really good point. So the endocannabinoid system is not something we learned about in medical school. It was a blank hole in our medical school curriculum. Even though when I graduated and became a doctor in 2009, we'd already known about the endocannabinoid system for 20 years. So that's really interesting. So now I go around and I teach the endocannabinoid system to university students and medical students, that sort of thing. So it's catching up. But that explains why cannabis, as you said, works so well for so many different symptoms. And that also explains why it's not a snake oil, as a lot of doctors think, because these receptors, they're everywhere in our brain and our body. So we can use the plant cannabinoids like THC, CBD in our brain. There's cannabinoid receptors in our womb, which is why it might help, period pain, endometriosis symptoms, that sort of thing. And it explains so much why I can have a patient with complex chronic pain, sleeping problems, digestive problems, and mood problems. And all of those symptoms can get better when you choose the right strains and the right type of cannabis medicines for that patient. So it really is a whole group of medicines. It's not just a single medicine.
Yeah, it's so powerful. I remember learning that a few years ago and I was like, it blew my mind. It totally,
Yeah.
totally blew my mind. And I know the show is called Witchy Wellness, so 99% of the listeners are women out there. Um, and as women, we, have to learn that we have to deal, quote unquote, with these women's health issues like painful
Yeah.
period, perimenopause, endometriosis. Like it's just it's something we have to deal with as a curse as women. And I don't believe that. And I do like I help with the emotional kind of side with that
Yeah.
with women, but the actual symptoms this can help with. And you said there's
Yeah.
receptors all over the body. So let's kind of dive more into women's health work, like what you've seen, kind of
Yeah.
speaking of what it can help with possibly. Um, yeah.
Yeah, yeah. So, one thing is always, important to say is that we need more research in women's health when it comes to cannabis, and we all can acknowledge that in this field, because and that's another problem with the lagging behind in research for women's health is then we don't have the evidence that a lot of doctors want to see to use these things like cannabis-based medicines. So, although we don't have big studies yet for women's health conditions, we do have really good observational data, meaning people who use cannabis for these women's health conditions, and we know that they find it very effective. And the side effect profile is quite good. People don't normally have terrible side effects from medicinal use of cannabis. So, where I find it can be really helpful in women who are younger that have problems with period pain, PMDD, which is a really severe form of PMS. That's actually a mood disorder. It can be very debilitating, where people get lots of mood swings the week before their period and can feel very anxious and have panic attacks. So there's that cluster. And then there's endometriosis, which is where the lining of the womb grows outside of the womb. And it can cause lots of different symptoms, pain symptoms primarily, but also things like IBS type symptoms that are missed for years. I have a lot of patients who, when they got to see me, they were either not diagnosed yet, and I helped diagnose them, or they were just diagnosed after having endometriosis symptoms for like 15 years. So, yeah, so, a lot of these problems even take a long time to diagnose because we're just not as good with women's health, and I don't think women are listened to as much as men with our symptoms, especially when it comes to period problems. It's just kind of like, oh, just take the birth control pill and go away, sort of thing. So when I treat someone who has one of these problems, medical cannabis can play a big role because it can help with their pain relief. It can help with sleep and anxiety relief as well. So you're targeting a few different symptoms at once. And a lot of times I'm using it. Another reason I'm using it is because people have tried other medicines and they've either not been able to tolerate them because they've had lots of side effects. And again, another side effect that's overlooked in women is sexual side effects from medications, which no one asks them about. Sometimes I'm the first person to even ask. And, that's why they don't want to keep taking some of the other medications that they're on. And so when we transition them onto something like medical cannabis, and not just medical cannabis, but, I use integrative medicine strategies. Like you said, we deal with the emotional and the psychological components. I do functional medicine testing. We look at the gut. We rebalance the microbiome. We look at the hormone profile. Like all of these things together can be really beneficial, and then just help women feel like they can get their lives back. Because that's what it's about. It's about not having to put your life on hold if you have terrible periods for a week out of each month.
Yeah, and from my understanding, and correct me if I'm wrong, is a lot of the research isn't done on women, whether in whatever industry, because of our periods, because from a medical research perspective, that's a variable you can't
Yeah,
really test through a big large sample group because we all are so different, and that's kind of
that's
the
right.
big thing that's kind of holding them back from diving deeper into research.
Yeah, that's exactly true. They choose even male mice because, the cyclical hormone changes we have. And even our endocannabinoid system changes throughout the month too. That's why people might need to dose their medical cannabis differently at different times in their cycle, which is really interesting. And even exercise differently at different times in their cycle, take different supplement doses. Like it's really cyclical. And the other reason why medical cannabis is not tested on women is because women of childbearing age, of course, with medical cannabis, I still can't give someone medical cannabis if they're trying to conceive actively or they're already pregnant or they're breastfeeding. Um, there's actually not any research saying it's definitely really bad, but there's some caution areas where we say, okay, well, it might affect the baby's birth weight, or maybe there's a few studies saying it might affect some really subtle neurocognitive kind of thinking changes in children who were exposed in the womb. So we still have a lot to learn in that respect, and that's why the research is so hard. But on the other side, medical cannabis side, giving people all of the research, the observational research into the risks in pregnancy of cannabis, for example, are done in women who smoked high amounts of high THC cannabis recreationally. That's really different than what I'm doing with someone medicinally. So we can't say that it's no risk, but I tend to suspect that the risk would be much lower than those studies that focus on the recreational high THC smoked cannabis. But for now, of course, we have to be cautious until we know more.
Yeah, it's always good to err on the side of caution for sure.
Yeah.
So I wanted to talk, I've never talked about this on the show, and I would love to learn more about, this is more, we're talking more, medical cannabis, kind of
Yeah.
very low dose, but this new frontier in medicine and wellness, which is therapeutic psychedelics and altered states of consciousness, not only for women's health, but, for me, working with that for personal growth, spiritual growth, more empowerment, and looking at it as a very, for me personally, it's a spiritual, but it's just a holistic approach to my own growth and well-being. So I wanted to dive into there, maybe talking a little bit, dispelling the myths and misperceptions of this as well, because I think it's an opportunity for a lot of people if it feels like the good fit for you.
Yeah, I think it's another area that is one of my interests in medicine is, altered states. And I've personally experienced altered states in a variety of different ways, including without psychedelic substances, like through holographic breath work, for example. So it doesn't have to be only through a substance, but often we're hearing more and more about those states as well. And I think a lot of women connect to those states because I think a lot of us feel quite cut off from community and from our feminine spirit, which is making me sound very woo for a medical doctor. But I think it's true. I think we live in a world that's very fast paced. We're not really connected a lot of times to maybe our intuition, or we feel like we have to give up critical thinking and only go in intuition when in reality we can actually use both and really integrate the two in modern life. And I think for a lot of people, alter states help them to do that. I know for me, it's certainly been a tool for, as you say, for personal growth. And I think for for my patients who have suffered with chronic health conditions, in the UK, the only therapeutic psychedelic we have to work with is ketamine. So we can use IV ketamine. And it's very controlled. So we can only do that in people who qualify with a certain diagnosis, for example, treatment resistant depression or treatment resistant chronic pain. But a lot of people go where it's legal and do it on their own. So there's legal places to go, and you can experience these things in more of a traditional ceremony, which has various ways of doing it. There's psilocybin retreats in the Netherlands that a lot of my patients have gone on. Of course, there's ayahuasca, which is a lot of people go to Central and South America to do that. And what they're finding, what they share with me, is that it helps them. It doesn't necessarily cure them, although I have had some people come back who've had chronic fatigue syndrome and weird stuff for ages, and their symptoms just kind of have gone away. But that's not the norm. The norm is more that they still have the symptoms, but they can cope with them completely differently. And instead of ruling their life anymore, they feel in control, and they feel like it's part of their journey, and it's no longer holding them back. And it just completely shifts their perspective. So I think they're really powerful substances. I mean, and then of course there's the other side of that, which
Have you taken the anxious personality quiz yet? Real talk. Not all anxiety is created equal, nor can you manifest the same way with it. Yes, that's true. You can manifest with your anxiety. I created this quiz so you can figure out how your anxiety manifests in your life, your emotions, your thoughts, and your actions. And when we have more insight into what our triggers and how to catch them faster, we're able to make lasting change and amplify what we want to manifest in our life. You can find out your anxious personality type at anxiousquiz.com. Learn to embrace and manifest with your anxiety today.
I have a lot of friends and colleagues who, we volunteer for these studies in, psychedelics. I haven't done so recently because I've been pregnant and had a baby and breastfeeding. But, I've also had colleagues go through some really high dose states and have some really dark trips. And these are people who are used to dealing with these substances, helping other people deal with these substances and process them and integrate. And I think that's also an important thing to talk about because, some of them have been, the trips have been really dark. And in order for it to be a learning experience and to not traumatize someone, it has to be so well held, that container. And then the integration work afterwards, rather than just going on a retreat and then you go home and you pack your bags and then you're home and then you're just left to deal with all the remnants by yourself. It's that integration work that turns it from a trauma into a learning experience. And I think there's most of the people I know who work in this industry, in the integration work, a lot of them are women. I think this is a very feminine thing, isn't it?
Oh, for sure, for sure. And I'm just thinking, I'm holographic breathing. That was kind of my first experience as well into these altered states. And, let it be said, and you do not need a substance to enter
Definitely.
just by breathing your breath. And
Yeah, it's amazing, isn't it? That was my first experience with it too.
wow, it opened
Yeah,
the doors for me. I'd been meditating for a while before then and had, some experiences here and there, but
yeah,
the breath work was just, it, dove straight in. And whether if it's through breath work or a substance, like you
yeah,
said, sometimes you have these quote unquote dark trips, but it's really showing you what is inside of you. And obviously we get very woo here, but it's nothing that's not already there that I found
yeah,
out. And when we can get into these alternate states or really just different brainwave states, when we
definitely.
can relax, our nervous system can release, we can integrate, and even getting into like a gamma state where we get these quote unquote downloads of higher
Yeah,
vibrational energy, you allow your body to do what it knows how to do. And what I found out, it's like maybe those experiences don't heal me, but I gain it wisdom or the perspective, like you said, a new outlook on how
yeah,
not only to accept those symptoms, but become grateful for everything. And you kind of see everything has led you to this point, and it's this journey that you're continually on. Like the tagline for the show is your body and emotions are not in the way, they're leading the way. And this is
yeah,
part of it. The deeper you
definitely.
dive, there's going to be stuff always, always, always that come up.
Yeah,
But these
yeah,
states of being allow you to get out of, like you said, that rushing, very masculine energy. Because in myself, I find myself so much in so many of the women that are millennial age group and
yeah,
beyond that are
yeah,
just our parents generation. My mom, huge feminist, did a lot of work, had to really push to get
yes,
into things and career, and just any even high school sports. Her high school didn't have any female sports,
yeah.
and so we grew up thinking, well,
We
look
have
at
to
us.
fight. We
We have
have
to
to
fight.
be the
Yes.
male. Yeah,
Yeah.
I absolutely agree with you. I think, in medicine, it's something I've experienced a lot is having to, well, knowing how to do things in a feminine way
Yeah.
it's still in an industry really dominated by men. I mean, it's changing. There's so many women doctors, but there's still those times when I feel that, oh wow, I'm really forcing myself into doing something in a more masculine way, and I have to really check myself and say, okay, I can choose to do this differently, because it's still, like you said, what our parents were taught. I was trained by women surgeons who were very the energy is very male because they had to fight for everything. And it's not a very happy way to live, is what I found, when you're constantly in conflict with maybe how you naturally want to be or behave. So it is so interesting, isn't it? Just finding that balance.
Yeah, and I find that for me personally, with my own women's health journey, whether it, chronic cramps or PMS pain, the more that I really was present with myself and embodied that feminine side, the symptoms just kind of naturally went away. And for me, it's definitely an indicator that that cycle, if it is more dramatic, if you will, then I need to take a look to see, was I really overly masculine, or was I not, what was I not paying attention to that last
Yeah,
cycle, whether emotionally, physically, spiritually. It's an opportunity for me to review, so I
yeah,
can, what do I want to let go of, what do I want to create next cycle, which as a woman, I'm so grateful that we're connected to that cycle. Everything in nature, in this reality, is cycle. We have the moon, the
yeah,
tides, the seasons. It's not the same thing every single day. And what I think
yeah.
we're talking about is the masculine is just all the time. And there's nothing wrong with that. Like, we, to be able to be in this reality, we have to go out and do things, right? We have to be in
Absolutely.
that masculine, but it's a balance of both. And it's
It's
a
a balance
balance.
of the beer and the doer, as I call it.
Yes,
Yeah.
yes.
Yeah. And I'm a very good doer. So I've had to
Yeah.
work really hard on the being part. And you're right. It's just, I got really into neurofeedback, which we don't do at the clinic currently because it's just really finicky and it has to be done in person. I do a lot of virtual stuff now since COVID, but it's an incredible tool for development, for getting into those deep brainwave states, and those twilight states, because we've kind of forgotten a lot of our twilight states. And that's why I think people are so drawn to psychedelics. Personally, I think if you look back before the Industrial Revolution, most societies had a way of getting into these altered states and these twilight states of consciousness, whether that was through, like, shamanistic work and breath work, whether most, well, I shouldn't say most, but a lot of cultures, of course, had a substance that they would use. And now we don't have that. And not only do we not have that, but we work all day, and then we expect our bodies, like a lot of my patients can't sleep. And then we just expect our bodies to just crash into sleep, or, we're not gentle, excuse me, with our circadian rhythms, our cycles, our natural 24-hour cycles of light and dark, and all the genes and all the clock genes that's supposed to get turned on at the right time of day and night. And it's tapping back into, I think, some of those slower twilight states that can be really healing for people.
Yeah, and I just thought of another way that has helped me a lot. Open focus as well is really, it helps change your brainwave state very easily. You don't have to be in meditation or breathe for an amount of time. It's just really focusing on the space in between things, like the space in between your ears, the space between you and a wall. It just instantly kind of calms you down and out of this like beta brainwave, and just
Yeah,
relax into the present moment. And I think for me, getting into a lot of this work and a lot of the doer type women that are, kind of exploring the woo and the alternative side, because they're like, there has to be something else. That's
yeah.
why I
They're
got into
burnt
all
out.
this. Yeah, they're burnt
That's why
out.
everyone's burnt out.
We're not familiar with what it feels like to be present and in our bodies, because sometimes we
Yeah,
don't want to deal with what physical or emotional things are there.
yeah,
But it's literally retraining our bodies to be okay with being in the present. And I found, CBD has helped immensely as a toolkit for me in that
yeah,
area as well. Not just alternate states, but just different toolkits like that, and biofeedback, and just finding
absolutely.
what works for you. And I don't know if you have any other suggestions of like how to create this mental but emotional well-being, this balance in your life.
Yeah. I think finding a practice, I find combining cannabinoids, even if it's just CBD without any THC, with a meditation practice is really beneficial. So I actually set all of my patients some kind of small practice to do after they've taken their medication. And sometimes it's as simple as a breathing practice. We're just breathing in through the nose and out through the mouth, making a seed sound like ha, like kind of a gentle ocean sound. Or whether it's a simple mindfulness practice where they just start by focusing on the breath. Or if I have someone who's very anxious, sometimes focusing on the breath isn't such a good idea for them in the beginning, makes them too anxious. So then we'll focus on, like you said, a space between things, or an area on the body, like the space under the nose, for example, like they do in Vipassana. So I kind of mix things up. If I have a patient who suffers from chronic fatigue syndrome or is just very burned out, then I will usually give them a recorded yoga nidra practice to do, which is a very calming meditative practice that you don't have to do any effort. It's very effortless, which is great. And then I just say, take your cannabis medicine and then lie down and listen to this. And it's so beneficial to combine these things, I find.
No, for sure. I know. I haven't done yoga nidra in a while, and I'm like, oh, that sounds so nice. It's just a beautiful. It's. I think the translation is like sleep, kind of is right. Nidra is kind of translated to
Yeah,
sleep.
yoga sleep.
Yoga
It was,
sleep.
yeah. It was, I spent about 6 months in India
Oh,
many years ago now, and we did a lot of study of yoga nidra. And my husband's a clinical hypnotherapist, so he does these lovely recordings for my patients. So I'm very spoiled with yoga nidra.
yes. Oh my God, that is so beautiful. So beautiful. Um, so I mean, these practices are great to kind of integrate into our daily life, but throughout the rest of the day, what do you have some tips of like how to deal with the rushing or like the mom guilt or just balancing so many things, being the doer
Yeah,
woman, because I know you balance a lot, having your own clinic, you're an author, you're a mom, just
yeah.
how can we have our cake and eat it too is I guess my question.
Oh, that's a great question. I mean, I don't have the perfect balance either. I'm always trying to just, achieve balance. And sometimes it's just not possible to be in balance, and that's okay too. And I think it's a really good message, I think, for a lot of people, is I'm not perfectly balanced all the time. It's just not possible. And I've let that go, because trying to be perfectly balanced all the time, that is another stress, another kind of obligation we put on ourselves, and it can lead to a lot more guilt. So I think the first thing is, wherever you are right now, it's fine. You're doing a great job, and just know that you're exactly where you need to be. And then from that point, of course, everyone wants to feel a bit better. So I find a nice practice is just doing a 1 minute. I call them resilience resets. So I just say, a 1 minute check in. When you start the day, then mid morning, lunchtime, mid afternoon, and then in the evening. And I get people to put, like, I'll set alarms on their smartphones or smartwatches if they wear one. And when that timer goes off, then it's just a reminder. Like, I actually like the vibration more than the timer, so it's not like, nah, every time it goes off and then you're feeling more stressed. But whatever works to remind yourself to take stock for a minute. And then I just have someone do a shortened version of whatever practice we've decided on for them. So the simple one, the simple breathing one, easy, minute of mindfulness, the Benson technique where you just repeat a word that means something to you on the exhale. So I use the word peace when I do mine. You can use the word one if you want something more neutral. I find that's a really nice one, because I find stress can build up over the day, and it can build up in the body. I can feel it. If I don't do this, I start feeling it in my diaphragm. I know my stress signature. I start feeling it in my shoulders and my neck, then in my diaphragm. And if I don't pay attention, then I start kind of feeling a bit tired, and I know my signature. So I think if you tune in and you find your stress signature, that's the first step. And you can do that by just tuning in a few minutes once a day for a week and writing down what you notice. That's literally it. It's just noticing. Then week two, you're like, okay, I know my signature now. So now I'm going to take this 1 minute reset a few times a day, see what happens. And I do find it makes a difference.
Yeah, I find that so important. Like I tell my clients I work with is like, what emotions do you feel? Write it down at the end of the day,
Yeah,
excuse me, for a week. But yeah, how does that feel in your how do you feel that stress in your body throughout the day? For me, I have different affirmations or mostly just
yeah.
emotions to check in with me throughout the day, like loved, supported. So I can take that second
I
and
love
just
that.
really sit down and feel it. What does that feel? Well,
Yeah,
no matter what I'm doing, I have a dance alarm because for me and my body,
love that.
I,
I
I get
love
in,
that.
I get in my head, and if I can just move, I love yoga. Like yoga really got me into all this as well. And just to be in your body, get out of your head and into your
Yeah,
body, just instantly will shift your brainwave state, will shift your emotional state. It just
mood,
brings you right
everything.
there. Yep.
Absolutely.
Yep.
And I'm right with you. I'm a big fan of dance. Dance is my passion and my hobby, and I've gone back to it, after I've had my son now, and it just fills my heart with joy. Um, but and I think that that's always the challenge for me is I love to do things. So the other challenge for me is sometimes just saying no. The other way to just, feel less stressed is just saying no to things, even when it's really hard. And this is something I'm still really working on.
Yeah. I think that is a lifelong
A
process. So
lifelong
yes,
thing,
yeah,
isn't it?
saying no, but also saying yes to you, right? It's
Yeah, that's right.
being in the letting go of what you should be doing
Yeah,
and what you need.
yeah,
And that that is such an important, simple, but sometimes doesn't feel a simple lesson. And I think
yeah,
integrating practices like, phone alarms or those techniques that you talked about, and
yeah,
it's just really helpful to set ourselves up for success, like if we
yeah,
like putting time limits. I know I have an iPhone, you can put a time limit on your phone for certain apps. If you
yeah,
know you're going to go down the Instagram or Facebook or TikTok scrolling binge, like we know that that's a cute puppy video might be good for that little hit for, dopamine for a little bit, but like little oxygen, but it's not gonna
yeah,
long term be beneficial. So for me, it's really learning to say no, set up
yeah,
structures for me to. I know my go-to stress responses. Like I'm
yes,
just gonna want to avoid, and I'm gonna want to binge, and so just setting yourself up for success from a loving point of view, non-judgment, even if you do end up
absolutely.
on there, but setting yourself up success because for me, I understand like the only constant in this life is change
Yeah, totally.
and being okay with that.
That's it, isn't it? And it's
Yeah.
just tools for dealing with change. I mean,
Yep.
when before I had my son, I mean, I'm really big on sleep. So I do a whole program for my patients to reset sleep and circadian rhythms. And then you become a mom, and I have a toddler who doesn't always sleep through the night. And, every time they go through a leap, they're up in the night. I mean, it's been constant lately. So, and we do all the right things. We do the sleep training and all the rest of it. But you can't control these things. So, it's a whole nother level. So yeah, what do you do when you just can't get 8 hours of uninterrupted sleep? And that's I think for me, that's been a huge journey because I'm so good with my sleep hygiene because I need more sleep than average. Um, and I just haven't been able to get it all the time since having my son, and I work, and just being okay with that, and just having like I take little naps. I will finish, clinic earlier, have a longer lunch, and take a nap. So I do things to make up for it. But it's really taught me that you can't rely on perfection. Sometimes the psychological strategies involve just saying, oh well, or reframing this catastrophic thinking of, oh, I'm going to have a terrible day now because I didn't sleep well, because this was me before. Oh my god. I even have a book that my son, i.e. my husband, got me for my birthday from River, my son. And it says, it's about mummy, mummy this, mummy that. And then it says, mummy is really great at something, but she's a little bit scared of lack of sleep.
Oh man, that is so cute. It's so true. It's letting ourselves off the frickin' hook because we have these beliefs, these thoughts that everything's gonna be ruined. I'm the same way with the
Yeah,
sleep thing.
yeah, yeah,
And today I allowed myself to sleep in. I didn't go to the gym before this, and I was like, guess what? I can go to the gym after this
yeah,
interview. And even if I don't want to go to the gym after, That's okay
It's
too.
okay.
It's
Yeah.
okay. And just letting go of the self-judgment, I think for a lot of us
Yeah.
is easier said than done. But man, I'm a lot happier when I love myself. I'll tell you that.
Yeah. Yeah, exactly. Everyone's
Yeah.
a lot happier. This is what I discovered. Yeah.
Yeah. Oh my goodness. Well, on that note, thank you so much, Dr. Dani, for coming on. Was there anything else on your heart or on your mind you wanted to wrap up before we start to close the show out today?
Don't think so. I think
Okay.
we covered a lot of
I
ground.
know we did. It was so much
It
fun.
was so much fun. Yeah.
Yeah. Well, thank you again so much for coming on here and doing the work that you
My
do
pleasure.
and your own personal journey as well, because I know that's what led you to be able to help so many people with their own. And we
Thank
close the
you.
show out the same way every single week. How may we, the listeners, as a huge act of gratitude, be of service for you in return today?
Oh, well, I guess just thank you for listening. And if you're interested in finding me, you can find me at my website, my blog, which is resilience.clinic. And even if you're in the US or abroad anywhere, there's lots there for you, lots of free tools and resilience assessment, and hopefully some tools to help you.
Amazing, amazing. Thank you so much again.
My pleasure.
And yeah, happy Thanksgiving. We're recording this on Thanksgiving to everybody out there. And yeah, it was such a pleasure. And remember, open up, surrender, trust, and let